All right, welcome back. This morning and this month, we are monitoring men's health. And, of course, this month is American Heart Health Month. So for our Monitoring Men's Health segment, well, we are taking a deeper dive into a healthy heart.
Now, according to the American Heart Association, heart disease is the #1 cause of death worldwide.
Oh, yeah. So this morning, we took our heart questions to the expert and got a little workout in at the same time.
It is really safe to exercise when you have heart disease. The question is how safe and how much to actually do.
Men are from Mars, women are from Venus. We're different. We are different. How does heart disease differ?
Yeah, so what we know is that most of what we call the classic textbook presentations for heart disease is mostly in guys. Women appear to have different presentations of heart disease, but they still have heart disease. The things to monitor when you're exercising is really about how you're feeling. And part of how you're feeling is based on what type of training are you trying to do.
It was over a course of time I realized something was wrong. And then I was working out, and I noticed that more that I leaned forward, I started to get dizzy. Like I was going to fall over.
Yeah.
But prior to that, I just thought, like we say all the time, oh, it'll pass. I'd sit back down on the bench for a little bit, take a little bit more air, and then I get up and I was fine. But right now, well, right now I would have kept going. Bam.
But I think it's one of those things, like you said, right, is that we often don't know, is this fine and it'll get better because I'm getting older? But I can't say that as a doctor until we rule out all the other stuff. We know that people may have heart attacks when they could have a sudden death event. They could be doing any day activities, it could be exercising. It's a lot about knowing what your numbers are and making sure your numbers and your overall health is taken care of.
I started 2.5 miles an hour. Is it best to start low and go up? Or should I, when I get on the treadmill, punch it right on up to say 5 and let's go for it?
I would definitely recommend going slow and increasing as you can tolerate it.
Okay. Well, right now I can't tolerate it anymore. No.
Yeah, so you're at a perfect spot then. You picked the perfect spot to start at. And so the nice thing about when you're doing strength training is that a lot of those symptoms that we talked about when you're doing cardio don't really apply as much when you're lifting. Because when you're not kind of pushing the heart as much. But the nice thing is that this type of exercise is really good for heart health in the long run.
Like, so you're watching this right now, you're like, oh, am I on the edge? I've had a little shooting pain here and there, or just tightness. When do you seek help?
I think it's never wrong to seek help. It's one of those things that you just never know, and all of our bodies are completely different. And seeing a doctor and making sure that you're all taken care of.
Just like we did, right?
Yeah.
All right, so it's also worth noting that sleep, hydration, and diet are extremely important when it comes to keeping a healthy heart.
Mm-hmm. I think one of the things that we learned was, if we say it all the time, see something, say something. In this case, feel something, say something. Don't think that it'll just pass and I'll be okay, because it could be the sign of something deeper inside.
Yeah, like you had as well.
Yeah, I dealt with the blood clots in my lungs, thinking that, oh, it's just a little winded, but no, it was a serious situation, and that does affect the heart as well as far as the heart pressures go.
Yeah, well, you got a good workout in, I saw.
Yeah, he kept going.
No, 5 minutes, that wasn't enough.
That's better than nothing.
Well, yeah, that is true.
This is me squatting 1,000 pounds, so they edited that out.
Yeah.
It's not cool.
Yeah. By the way, the dumbbells, that was Anthony on the dumbbells.
Oh, yeah, he was ripped after that.
Didn't get to see his
Couldn't
face.
see much of me. Yeah.
Stay with us now. Today in St. Louis at 6 a.m. starts right now.